Thank you, Mr. Speaker. Honorable CS, welcome once again to Senate, and thank you for the responses you have given. The question you have been requested to answer is sensitive because it deals with persons with disabilities. And Honorable Speaker, what is the ministry policy in working together with organizations and initiatives that are non-profit making, which are adding value to the facilities, medical facilities that are being given to persons with disability? And are you aware of Belarisu Medical Center that is doing cleft lip and palate, and which has speech therapy facilities, and which, if you had an MOU with, you would help a lot of children who have gone through operations on cleft lip and palate? And what are you doing to support such institutions so that they do not fail, but they can use their world-class facility to benefit many more children who have gone through trouble with cleft lip and palate deformities?
Thank you, Honorable Speaker and Honorable Members. One of our approaches in delivering universal health coverage is partnerships with donors, with NGOs, and other non-governmental actors, including civil society, in ensuring that we deliver universal health coverage. What we have done at the ministry is that in the past, most donors, partners have been delivering vertical programs. But it is now at the Ministry of Health, we are putting together to ensure that we work together towards achieving the government objective of universal health coverage and leaving no one behind. Let me acknowledge that I have not personally interacted with the Belarisu, and I'm happy, Senator, that they are dealing with cleft lip and palate surgery. We shall, as we retreat back to the ministry, we shall get in touch with them and see how best we can work together to support them in the work they do. But in the interim, we are working together with all partners to ensure that we leave no one behind in our coverage in our universal healthcare coverage. Thank you, Mr. Speaker.
Are you in any way suggesting that you'll be proposing conditional grants in the next budget so that you can give the county governments to equip the facilities? Thank you.
Thank you, Honorable Speaker and Honorable Members. As I said earlier, that delivery of healthcare is a shared service between the national government and the county governments. Honorable Speaker, in the last 2 months where we did the level of service assessment, this exercise was undertaken together with the county governments. And in all the health initiatives that we undertake, we do it jointly with county governments, so that one, data is shared immediately, that they are able to know the results of the assessment that has been done. Honorable Speaker and Honorable Members, as I said earlier, we shall be sharing a final report on the gaps that were identified. I want to believe, Honorable Speaker and Honorable Members, that then gives this House an opportunity in advocating for more resources to county governments to be able to bridge the gaps that we identified during the report. And I want to thank the Honorable Senator for proposing conditional grants to county governments to be able to deal with the gaps that shall have been identified. I submit.
I'd like to know the position of the ministry in regards to establishing proper assessment centers in this country, Honorable Speaker. I'm aware the only assessment center that government has is the one available at the Kenya Institute of Special Education. But considering that is used for assessment and training, therefore it limits the availability of that facility for purposes of assessment. What is the ministry doing to ensure we have at least, if not in every county, every region, a proper assessment center so that persons with disability can be able to access it?
Thank you, Honorable Speaker and Honorable Members. I acknowledge the question. Previously, assessment was only at one level, at the ministry. But right now, the assessment has already been devolved. So each county has a team, multi-stakeholder team, multidisciplinary, that has been trained to do assessment for disability. And I am informed that this has been happening now for the last 2 years. And we continue to build capacity of those multidisciplinary teams at the county levels to be able to do assessment. But equally, we have assessment being carried out at all the level 6 facilities, which are 6 in the country. So on the 47 plus 6, that means that then we have a total of 53 assessment places where assessment of disability can be done. The ministry, however, continues to do appeal cases where an assessment has been done in the county and the person is not satisfied with the results. The Ministry of Health at the national level, we work on the appeal cases. I submit, Speaker.
What did the Ministry of Health do for creating awareness on dyslexia? Because, you know, Honorable Speaker, dyslexia is a condition that has many times been misdiagnosed. Senator Bugu and I attended that particular celebration at the Kenya Institute of Special Education, which again, Honorable CS, is important to note that you and your ministry was not represented. At least Parliament was represented because Kedipa was there, but the ministry was not represented. I did not see them doing anything in terms of awareness. And also finally, I would want to know whether the Cabinet Secretary is aware that 100 kids that have this condition of dyslexia do not have a school to attend in January because the Kenya Community Center for Learning that has been taking care of them has been, Senator Bugu is well aware of this particular challenge. They have been driven out of the place that they have been using as a school for the last about 5 years. At least the other time they were helped by Kedipa, but we have not seen the ministry do anything in terms of supporting children living with dyslexia.
Thank you, Honorable Speaker and Honorable Members. I appreciate Senator Medhu for bringing out the issue on dyslexia as one of the disabilities that do exist. Honorable Speaker and Honorable Members, as a ministry, we follow the World Health Organization calendar of celebrations of specific days within the health sector. And dyslexia is yet to be put in the World Health Organization calendar of days to be celebrated. However, we continue to provide and create awareness in the day-to-day activities. But I would also like to say that as a ministry, we would like to take a whole of health approach, that we are not highlighting just one of the disabilities and celebrating or creating awareness around it, but rather looking at the whole area of how do we mainstream disability into the health sector and the health services. Having said that, Honorable Speaker and Honorable Members, it has been acknowledged that children with the dyslexia, if not identified early, then they may not reach their full potential. And I want to acknowledge the one that has been highlighted by the Senator as being the best swimmer. So we want to acknowledge and say that as a ministry, we are really going to work with the 100,000 community health promoters that we have trained, that they should be able to identify these cases early so that they are brought out, so that then alternative ways can be devised on which the children can be assisted to reach their full potential. I submit.
The minister is aware that one of the need that is required by people living with disability in as far as access to reproductive health care is concerned is that a large percentage of them require assisted delivery, the mothers. They require surgery. And the biggest impediment, Minister, is the cost of access to that surgery. Do you have a policy in the same manner that you have for children under 5, so that when these women living with disability, when they go to the healthcare place, they are not denied charges because they cannot afford? Thank you.
Thank you, Honorable Speaker and Honorable Members. Indeed, I do acknowledge that women with disability require assisted delivery. As the government, we have 2 programs. One is Linda Mama, which takes care of all women in terms of delivery. And actually, it begins from them being able to attend clinics, delivery, and even after delivery, they are able to attend clinics. This financial year, Honorable Speaker and Honorable Members, the government put 4.98 billion for support of Linda Mama. Secondly, we have government subsidy, health insurance for people living with severe and disability, that they are able to access health services. But having said that, Honorable Speaker and Honorable Members, one of the acts that was enacted is the Social Health Insurance Act. And in that act, we have developed benefit package to ensure that every person is taken care of. Those who are unable to pay, the government is going to work on a program to ensure that they are able to pay for them to be able to access services. Equally, in that Social Health Insurance Act, we have the Primary Healthcare Fund that ensures that all primary healthcare, level 1 to level 3, is publicly financed, to mean that people will not have to pay any out of pocket to access services. I submit, Honorable Speaker.
My concern, my question, Madam CS, would be still on the CHVs in terms of their duration of contract and also in regards to the kits that they are supposed to have, because we've noted that some of them do not have, they are not fully equipped, and also in the very remote areas, some also do not have the same kits. And I note the county that I represent, that is Nairobi, we still have some shortages. So I would want to know what framework, what mechanisms have you put in place so as to ensure that there is total facilitation and equipment of the same personnel so that they are able to deliver their services. And just quickly on autism, which is a disability, what is your take on the cost of the medicine that is normally undertaken by these patients, because the cost of medicine is very high? Thank you, Mr. Speaker.
Thank you, Honorable Speaker and Honorable Members. I want to appreciate the accolades from the Senator of Kwale. It was a very nice experience to be in Musambweni to launch the Cancer Awareness Day. Honorable Speaker and Honorable Members, I would like to highlight that the community health promoters, Senator, we now call them promoters, not volunteers, do not have a contract. One is that these community health promoters are identified by their communities. After being identified by their communities, they are taken through training, both by the county and at the national level. And we have an agreement with the county governments that we are going to give them a stipend. We are going to co-match, that we give 50% while the county governments give 50% of a stipend. And that is more of an appreciation, so we do not have written contracts with them. But we have community health assistants that then supervise them to ensure that they are carrying out their duty, and those community health assistants have contracts with the county governments. Honorable Speaker and Honorable Members, we did launch a total of 100,000 community health promoters. And before we did launch on the 20th, 3 weeks before that, His Excellency the President had flagged off equally 100,000 kits, to mean that each of the community health promoter has a kit that is fully equipped with the items that we have put in there to be able to address the issues within the community. But after the launch, Honorable Speaker and Honorable Members, we have received feedback from the counties that not all community health promoters were covered within the 100,000. We have received a total, we have put together a total of 20,000 across the county of community health promoters. We are going to put them through training, and after the training, then they shall be given the kits so that they are able then to carry out the work that we have asked them to do. On autism, Honorable Speaker and Honorable Members, autism is a developmental disorder affecting children, and management involves many interventions, especially medications and behavioral therapy that is being worked on. However, I would like to say that in the new acts that we have now, under the Social Health Insurance Act, we are developing a benefits package. This benefits package, our plan is that it should include everyone, all services that are required. There are no exclusions, there are no limits within that. So it is our hope that as we finalize with the regulations and we go into implementation, no one is going to be left behind. Whether with autism, whether in any other form of disability, we should be able to take care of all of them under the essential benefits package that we have developed. I submit.
My question is, Mr. Speaker, how are they assisting the counties, Mr. Speaker? Because they have limited resource, because much of the resource, Mr. Speaker, are left at the national level. We don't have equipments in the county government, Mr. Speaker, like, for example, in health centers, where the community health workers are responsible, Mr. Speaker.
Thank you, Honorable Speaker and Honorable Members. Specifically for the community health promoters, we required standardization and consistency. So at the national level, we are the ones who have undertaken training for the community health promoters. Equally, the kit was funded by the national government. We are also giving them gadgets, smartphones, so that they are able to collect data real-time, data that will be used for decision-making in the health sector. That is an investment by the national government. The stipend, 50%, is an investment by the national government. But having said that, Honorable Speaker and Honorable Members, I did say that 2 months ago, we did a level of service assessment. From the level of service assessment, we have a report that indicates what are the gaps within the facilities in the counties. Notably, we have big human resource for health gaps. We have big gaps on health products and technologies. So we are working together with the county governments to derive a mechanism on which we are able to fill these gaps. But Honorable Speaker and Honorable Members, in the enacted laws, the Social Health Insurance Act has a primary healthcare fund. And this primary healthcare fund is supposed to ensure that all facilities at the primary level, that is level 2, level 3, are funded to ensure that they have human resource and they have health products and technologies. You will recall again, Mr. Speaker and Honorable Members, that one of the laws that was enacted is the Facility Improvement Fund. The Facility Improvement Fund is supposed to ensure that funds for the county, for the health facilities, are ring-fenced and replowed back into health facilities so that then they are used to ensure that there are no gaps in service delivery. So as currently we are working on the regulations, and we should be able and ready to go by in the next maybe a month or 2 months, and then we shall be advising Kenyans on what we are going to do in terms of meeting the gaps that do exist. I submit, Honorable Speaker.
To what extent and how are PWDs and their representative organization involved in designing, planning, implementation, and evaluation of health policy and programs?
Honorable CS.
Honorable Speaker and Honorable Members, as we are aware, stakeholder participation is enshrined in the law. And therefore, we do involve people with disabilities when we are developing policies at different levels during public participation. Having said that, Honorable Speaker and Honorable Members, at the Ministry of Health, we have officers who are living with different disabilities, and they are involved in drafting and in working on the policies that we do make. I submit, Speaker.
I would want you to speak more on this, because we've had so many cases of women with disabilities losing their lives at the time of delivery.
On employment, the 5%, as a ministry, we are continuing to ensure that more people are trained to be able to carry out these services. And as and when they graduate from the trainings, then they should be deployed adequately. But as it stands now, the 5% is low. But the only way is to ensure that we have more people trained to be able to handle the different forms of disability that do exist. I submit, Speaker.
could the Cabinet Secretary disclose the initial cost of the project for the construction of the Kakamega Teaching and Referral Hospital as was awarded by the county government of Kakamega, state how much of that amount has been paid to the contractor so far, and indicate the percentage of construction works undertaken so far. B, what are the reasons behind the stalling of this project? C, what measures will the government take to secure the construction site and put an end to the ongoing vandalism and theft of construction materials, including equipment? Finally, Mr. Speaker, what is the government doing to execute the presidential directive that the national government takes over the stalled project? I thank you.
Thank you, Speaker and honorable members. Schedule 4 of the Constitution of Kenya distributes functions between the national and the county governments. Under the national government, we have the referral health facilities, which are 6 that are fully, that the national government is fully responsible for. Kakamega County Referral Hospital, from our records, is categorized as a level 5 hospital under the county government of Kakamega. The stall project for the construction of the Kakamega Teaching and Referral Hospital was designed and constructed by the county government of Kakamega, which we had hoped that they will be given, they will have sent in their response, so that I'm able to respond conclusively to question 63A to C. So as it is, Honorable Speaker and Honorable Members, I'm not in a position to respond comprehensively to Part A, B, and C. Having recognized that, I wrote to the Governor of Kakamega County on the 25th of October, and in my submissions, I have attached the letter that I wrote to the Governor, asking him to provide responses to Part A, B, and C of the question, so that then I can come with them to this House. And I indeed copied the Clerk of the Senate my letter requesting for response. But as to my coming here this morning, we have not received any response from Kakamega County, despite several follow-ups. So, Honorable Speaker and Honorable Members, I would like to request that the Kakamega Governor is asked to come and respond to the questions, or send the responses to my ministry so that I'm able to respond to it. Having said that, Honorable Speaker and Honorable Members, on the last bit of the question, the reference is made to the presidential pronouncement regarding the support towards the completion of Kakamega Teaching and Referral Hospital. The pronouncement indicated that resources be allocated to cater for purchase of medical equipment for 100 million Kenya shillings in the supplementary budget of October, and 200 million to be allocated for civil works for completion. Honorable Speaker and Honorable Members, the 200 million allocation was based on availability of funds to be given to Kakamega County. So far, these funds have not been availed by the National Treasury, and we await for them to avail the funds, then they can be dispersed to Kakamega County. Having said that, Honorable Speaker and Honorable Members, we are working on a program to equip the Kakamega County Referral Hospital and other hospitals that have major equipment gaps. And the promise or the pronouncement by the President of 100 million shall be then be fulfilled once we are equipping other hospitals. But it's important to note, Honorable Speaker and Honorable Members, that we can only equip a hospital that has been finalized, that construction must be complete for us to be able to equip the hospital. So we shall be waiting at that point. When that is done, then we shall be putting in the national support of 100 million shillings towards the equipment. I submit.